Good afternoon, everyone. My name is Debra Goodsell, and I'm the director here at the Lunenburg Council on Aging. And I just wanted to tell you a little bit about navigating hospice. And just to give you a little bit of history, I actually worked for hospice for 8 years prior to becoming a director in Clinton. So I was in Clinton for 10 years, but prior to that, I worked in hospice care. And that came about because I was working at an assisted living, and I had the honor and privilege of sitting with some individuals who were passing, and I found it very interesting, very intriguing, and was something I really felt a calling to do. So a couple weeks back, I was invited to do a talk about hospice, navigating hospice, for caregivers as a resource at the Caregiver Resource Fair at Clark University. So I wanted to do it again here for us, for our information. And even if you don't need this information now or in the future, somebody you know is going to need this information. So you having the knowledge of hospice is going to be helpful at some point to somebody. So we're going to do an introduction to what hospice care is, because it can be confusing on what is involved, what's not involved, who's eligible for the services provided, hospice team, when to consider hospice, cost and coverage, key principles, tips for families, when to consider hospice, common misconceptions, and life after loss. So, can't see the forest for the trees. Basically, when you're dealing with and having to take care of somebody who's at the end of life, you're not always seeing clearly. You're not seeing what the needs are, what the wants are, and the assistance that is available to you. So the idiom, can't see the forest for the trees, means that parts are distracting you from the comprehending the whole. You can't see the entirety as you're preoccupied with the details and overlook the bigger picture or the end goal. Many times hospice care is added to a patient's care plan too late. Because let's face it, the family's struggling just to get through each day. And physicians are trained in curative medicine and have very little training in end-of-life care. Hospice care started early is both beneficial to the patient and the family and caregiver. So a lot of times people will call hospice and say, my loved one is dying. Hospice care is 6 months. The doctor feels that with your prognosis, your end of life will be within the next 6 months. So people calling to get hospice on board the last 2 days isn't really helpful. If you have hospice for 6 months prior, they know you. They know your likes. They know your dislikes. They know what makes you feel better. They know what makes you feel calm. They can stay ahead of the pain. If they come in at the last minute and you're in pain, it takes a lot to get that pain under control. So having hospice earlier is beneficial to everyone, but it also is beneficial to the family and caregivers, and we'll talk about that in a minute. Understanding hospice. So hospice care is quality of life and is not curative treatment. So what is palliative care? So hospice care, how can I say this? So if you are a Catholic, you are Christian, but not all Christians are Catholic. Same thing with palliative care. People that are on palliative care are all hospice patients, but not all hospice patients have palliative care. Palliative care is care when you're not terminal, and there's no cure, but you don't have 6 months or less to live. So basically, if you have a non-curative disease, you can be on palliative care because there is no treatments for you. It's comfort care only. But the difference is, if you are on hospice care, it is palliative care, but it is 6 months or less. So that's the difference between the two of them. So the aim of hospice is to relieve pain, manage the symptoms, offer emotional, spiritual, and practical support for both the patient and the family. And that's key in this whole hospice care plan, is it's not just the patient, it's the plan of care for everybody. So if the son isn't dealing well with the mom's passing, if this isn't going with this one, if there's struggles within the family. So there's a whole team that takes care of the whole family, not just the patient. When is hospice care recommended? Hospice care is recommended under the following circumstances. When a patient is diagnosed with a life-limiting illness, cancer, heart failure, end-stage Alzheimer's, and there is a guideline to go by for each of these. So if you have Alzheimer's, you can't be on hospice just when you find out you have Alzheimer's. It would be end stage. You cannot no longer do your a daily routine.
Activities.
You can't dress. There's ADLs.
Activities
Yes.
of daily living.
Yeah. So you basically, you can't feed yourself, you can't dress yourself, you can't toilet yourself. You have less than 5 intelligible words in your vocabulary. There's a certain guideline that Medicare puts out for each of these diagnoses. If the focus of care shifts from curative treatments like chemotherapy to comfort care, emphasizing quality of life. So basically, if you decide you no longer want to do chemo, you no longer want to do radiation, you no longer want to go to the hospital, then you would call about hospice. When the patient experiences significant symptoms that are difficult to manage, such as pain or shortness of breath. If the patient and family desire support for emotional and spiritual needs during the end-of-life process. These indicators can help guide the decision to initiate hospice care, ensuring that the patient receives the appropriate support and comfort during the final stages of life. And when hospice comes on early enough too, we have the opportunity to talk to that patient and see what their needs are, what their wants are. Maybe they want to be fully alert when the grandchildren are visiting, but otherwise they want to have medication and get some rest kind of thing. So we get to know the patient and what their needs and wants are. Hospice team. And this is a great thing because the hospice is a team approach to care. The volunteer is just as important as the doctor. Everybody works for this patient and what their needs and wants are in the family. So you have the hospice doctor, he's the director, works with the patient's primary care physician to manage their condition and develop a care plan. The hospice nurse or case manager, and they manage the medication, educate the patient and family, and coordinate care and with the rest of the care team. So the nurse manager will say, they really need a nurse's aide in there twice a week for showers and care, or manage that whole medical part of the team. Hospice aide, these aides are like certified nursing aides, but they're hospice aides. They're trained specifically to deal with patients and their families who are at the end of life. So it's definitely a specialized care. Social worker, which is amazing. So part of the team is the social worker. So the social worker can work with the family dynamics. The social worker can deal with maybe some things that they wanted to do they never did, or just feelings within the group and the family, just working with the whole family and the patient to resolve any issues that may arise. We also have a chaplain and spiritual leader. So the chaplain, you can, like I said, any of these individuals, you can say, we don't want a social worker. We don't want this. You do have to have the nurse and the doctor. They are a must. You don't have to have the volunteers. You don't have to have the chaplain. But the chaplain will come in, and the chaplain is whatever you are. Whatever your leanings are towards spirituality is what the chaplain will be there for you. And then train volunteers. It's getting dry in here, me talking. So the trained volunteers are trained in hospice care, and they're so valuable because the trained volunteers can go in there and spend time with that person while the family maybe goes and gets a haircut, or can sit vigil. And especially in a nursing home care scenario where the nursing staff can't sit there with the individual, and maybe the individual doesn't have any family. And then the hospice volunteers will stay with them until they pass. Where does hospice care take place? Wherever the patient is. Wherever that patient is, whether they're at home, in a hospital, a hospice facility, a nursing home, a family member's home. And the services provided are medical care, pain and symptom management, medications and equipment. So they'll bring in a bedside commode. They'll bring in a bed, adjustable bed. They'll bring in an air mattress so we can, not get bed sores. Emotional and spiritual support, counselors, chaplains, and social workers. Respite care. temporary relief so the family can have a break, and bereavement support. Unlike any other care, hospice care follows the patient and family for 13 months after the patient's passing. So that first birthday, that first Father's Day, Mother's Day, anniversary, Christmas. So it follows up with the family and makes sure that everyone's doing okay. And if they can help in any way, they will. What do I need to know about hospice care? This is a misconception that really is, we need to get the word out there. Hospice care is available 24 hours a day. They are not there 24 hours a day. So hospice, if you're at home with your loved one and it's 2 in the morning and they're having pain, you can call the hospice. Somebody will come and manage the medication or help you out and talk to you, but the hospice isn't there round the clock. They're not in your home 24 hours a day. So they're available, they're not present. And hospices are required by Medicare to have hospice trained volunteers. 5% of all of the employee hours need to be volunteer hours. It's a requirement of Medicare to have these volunteers. So if anybody's interested in volunteering, that's a nice volunteer opportunity as well. In the United States, Medicare, Medicaid, and most private insurances cover hospice fully or mostly, and Medicare hospice benefits cover the physician services, the nursing care, medication related to the terminal illness, medical equipment like hospital beds, and supportive services. And hospice will go that extra mile as well. There are massage therapists who volunteer. There are comfort pets that come and, somebody, if that's what they would like. And, part of the hospice experience is letting those dreams come true. I always wanted to go to the beach, and I haven't been to the beach in years. Making those little wishes happen. And most hospices, if not all, have a foundation attached to them that can make those things happen. So in summary of this, patient-centered care. The patient's wishes guide the plan of care. So if you don't want things, you don't have them. If you want more things, you get it. If you want, whatever your desires are, because that's what our goal is to make your final time here comfortable. And also quality of life. Focus on dignity, comfort, and peace. Available 24/7 with on-call services. When do we consider hospice? Frequent hospitalizations or ER visits. You're going to the ER way too much, way too frequently. Declining ability to perform daily activities. Significant weight loss or physical treatments. And decision to stop curative treatments. So those are just some of the things to think about when you're considering, should we get hospice care? Is it time to call in hospice care? Self-care for caregivers. And this is a statistic from, I believe it was Harvard University. 70% of all caregivers over the age of 70 die first, before the person they're caring for. Being a caregiver is a lot. You are taking care of somebody you love, and in the meantime, you're not taking care of yourself. And like I said, I had a perfect example with my parents, where my mother did not go to her doctor. She did not go to her hairdresser. She did not do anything for herself because she was taking care of my dad. And meanwhile, she ended up in the hospital because she wasn't taking care of herself. So it's important to consider self-care when you're looking at hospice. Caregiver syndrome is an increasingly popular way to describe the results of caring for an ill or dying loved one in terms of the impact on the caregiver's physical health, mental health, and emotional well-being. The term appreciates the relentless fatigue, shock of diagnosis, changing roles from partner to nurse, guilt, resentment, depression, and outright grieving as you watch your loved one failing and in pain. A social shift is necessary to prevent this 70% from including more caring family members. How can we slow down or even stop caregiver syndrome? The first big step, if we as a nation of smart individuals can transform how we see the time in life when we get to care for our aging loved ones, not as disappointing burden or as a dreaded future accompanied by denial, but rather if we could come to expect and accept the fact that along with our increasing longevity, many of us will also be required to become caregivers, and many of us will need to be cared for ourselves. And the second step is knowing that this stage of life is predictable in our futures. We can go through it intelligently and with proper planning and support, which can result in much healing, tenderness, and completion, and even joy. Hospice supports the family of the patient, offering emotional and spiritual counseling, caregiver training, and respite and help in navigating grief and loss. Part of being involved with a hospice is there are things that you will learn and find out that you would have never known previously. So if you have a hospice nurse coming in, they can tell you one of the things that's going to happen is modeling. When I first started working for a hospice, I didn't know what modeling was. What is that? And basically, the blood flow isn't getting to the extremities, the tips of the fingers, the toes, the tip of your nose, so they turn a bluish color, almost like a bruised color. So if that happens and the family member is not aware that this is a natural part of the process, it can be very disturbing. It can be, something that weighs on you. So knowing the process, knowing what's going to happen, knowing that, when your kidneys are shutting down, the urine becomes like coffee grounds. There's certain things that if you were to see that, you'd go into panic, like what's happening, what's going on. But with hospice, those fears are away because you know the process, you know what's happening, you know what to expect. So we have the emotional and psychological support, counseling from the social worker caregivers, managing stress, guilt, anxiety, anticipatory grief, planning to live your life without your loved one, and filling that void is something that you can talk to the counselors about because it's real, and that hole is something that you need to anticipate and be able to navigate through. Education and training. Hospice teaches caregivers how to care for the patient, administering medications. A lot of people who aren't in the medical field, when you say, okay, this is sublingual, they don't understand that that's under the tongue. So getting that knowledge from the nurse and the hospice team is valuable. Preventing bed sores, helping with feeding, bathing, mobility, and caregivers are shown what to expect as death approaches, and this reduces the fear and confusion. Hospice nurses are available around the clock by phone or for emergency visits. Caregivers are not alone, and they have a clinical team to rely on. So medical and practical help, hospice provides the home visits by the nurse and the aides, medication, supplies, and equipment, and this reduces the workload for caregivers and eliminates much of the logistical coordination. Respite care, caregivers can get a break. Medicare, it does cover up to 5 days of inpatient respite care. So your loved one can go to a facility like the Highlands for 5 days, and Medicare will cover that if you need to go to a wedding in California. So there are things that are available to you that you may not know otherwise. And some hospices offer in-home respite as well. They have individuals that will come stay at your home. And grief and bereavement support, and like I said, serves the families for up to 13 months after the patient's death. So, summary on how hospice helps caregivers. So you've got emotional help by counseling support groups, grief support, physical, home health aides, nurses visits, medical equipment, educational, training on patient care and symptom management, logistical, the medication delivery, care coordination, emergency, 24/7 on-call nurse available, temporary respite care, and after death, grief and bereavement support. Common misconceptions. Hospice means giving up. No, hospice is about living well for the time you have remaining. You must be bedridden. No, many hospices patients are still mobile and alert early on. Somebody might find out that they're terminal and they've got less than 6 months to live, but they're still doing everything in their home. They're still out in the community. They're still doing everything. So you do not have to be bedridden. You can be still alert and mobile. It's only for cancer patients, and that is untrue as well. It can be liver failure, kidney failure, dementia, Parkinson's, can be anything that is life-limiting. And you can't leave hospice once enrolled, and that is untrue as well, because you can graduate from hospice. We had a lot of nursing home patients will come on end stage, and once we come in as the hospice, we're now feeding them where the nursing home didn't have time to do that. We're now taking them outside. We're now doing things with them, and they're more engaged in life now, and they're gaining weight, and after 6 months, we review and say, wow, they're really doing well. They no longer qualify for hospice, and they graduate from hospice. So, and also too, if you are on hospice and you are terminal, and you decide, you know what, I don't want this. I don't want people in my house. I don't want the extra care. I don't want it. You can also step off of hospice as well. Final tips and takeaways. Start the conversation early, before a crisis. You know, it really is beneficial to call hospice in early, even if you don't think it's time. And like I said, perfect example was my dad. I mean, I worked in hospice. I know all of this. And I'm like, he looks fine. He's fine. He's fine. And hospice came in the last couple days. And I'm like, this is what I tell people not to do. And that's what I did. So like I said, if you even think there's an inkling of possibility they qualify for hospice, call the hospice. Let the hospice come in. Let them evaluate the patient and see if they do qualify. Because if they do, you're getting that extra care. And especially in a nursing home setting, you're getting nurses' aides that come in, volunteers that come in, the nurse that comes in. You're getting, God bless you.
Thank you.
You're getting all of these extra eyes on this, your loved one. So definitely, like I said, call the hospital, let them tell you that they don't qualify and that they'll check back and see. So, but don't wait till the last minute. And then choose a hospital provider that matches your values and needs. Trust yourself and know when it's time to ask for help. And I just wanted to thank you all for coming. I didn't know if anybody has any questions or anything, but we'll end our presentation. And if anybody at home does have any questions or anything, they they can absolutely call me, 978-582-4611, and I'd love to speak with you.